A cast for a broken arm, $500. $34,000 for a heart valve procedure. A new federal mandate means hospitals must post their prices online.
But after poring over those pricing menus, News 13 found they are not as straightforward as they seem. News 13's Madeline Schmidt takes a look at what you might pay at some of New Mexico's biggest hospitals, and she's live this evening at UNMH with that story. Madeline?
You know, Jessica and Dean, it's a bit of a strange thought, a price list that resembles a bit of a restaurant menu, but critics say it reminds them of something else.
It's like the sticker price on a car. It's not what you're actually going to pay.
A federal mandate that kicked in on the 1st requires hospitals nationwide to post their prices online. Take a C-section, for instance. UNM Hospital says it'll cost about $2,800. A couple miles away at Presbyterian, more than $5,000. But can patients rely on these numbers?
Unfortunately, it's not actually going to provide patients with useful information because almost no one pays the price that hospitals charge for medical care. Those prices are just a starting point for negotiation, and every insurance company negotiates a different price.
Kristina Fisher is with Think New Mexico. The group worked with lawmakers to launch a state website last year that compares Medicaid costs for procedures at hospitals around the state. But they want all patients to have this useful information at their fingertips.
Some states have started collecting data on the actual prices being paid for health care by everybody, and we're going to push New Mexico to do that. So then we can say, if you're with Blue Cross Blue Shield and you want to get a hip transplant at this hospital, what's the average price you can expect to pay?
We reached out to Presbyterian, Loveless, and UNMH. Presbyterian did not get back to us. In a statement, Loveless said in part while they support transparency, medical services billing is a complex issue. The price list is more of a starting point for patients, and that in most cases patients will pay lower than what's listed after insurance kicks in. UNMH directed us to the state's Hospital Association, which echoed Loveless, but also said this mandate isn't bogus.
I think it's helpful for consumers, it's helpful for the general public, it's helpful for policymakers. It's also helpful for hospitals and providers to be able to compare and get a sense of where they stand.
Think New Mexico says it will be teaming up with lawmakers for this upcoming session to push for that database with more accurate hospital prices for all New Mexicans to use. Back to you.
Thank you. We've posted links to those hospital price menus. Just head to alwaysonkrqe.com. This mandate, by the way, was part of the 2010 Affordable Care Act.